My name is Dr. Chetan Ginigeri. I'm a children's ICU specialist working in Bangalore. And in our ICUs, almost 30 to 40% of our work is treating children who have put themselves in danger. Children who have fallen down from balconies, drowned in swimming pools, electrocuted in our homes, having consumed corrosive poisons and other dangerous things like button batteries, or having bitten by snakes and scorpions. These are all children who would have been playing 1 second and fighting death another. No other disease in mankind is killing as many normal children as much as accidents. The sad part is 90% of these accidents are easily preventable. Childhood accidents are predictable and preventable. Child safety is not our choice. It is a responsibility. We owe it to the generations of the future. Let's make this world child safe. The incidence of poisonings in rural India again is very high, and the reason for that is again multiple. Agricultural products which needs to be sprayed with insecticides, pesticides, etc. are stored inside the households of farming families, and sometimes children do find easy access to them. And because they come in very colorful packaging, both in liquid or a solid form, sometimes children can open these vials or cans and then consume them. The other way poisoning happens is when these insecticides or pesticides are being sprayed onto the field and children in very close vicinity. These insecticides can get access to the baby's bloodstream either through inhalation, ingestion, that is while eating, or through direct absorption from the skin. The other form of poisonings that we see in rural India is predominantly kerosene poisoning, which comes through ration shops or a public distribution system, because most of these kerosene is then mixed with a very bright copper sulfate to give it a distinct look of a very blue bright liquid. And then many of these kerosene is stored in either Pepsi bottles or Bisleri bottles next to the kitchen, where parents use this for cooking purposes. Children finding it, especially in a hot summer day, can sometimes open and drink it, and that causes serious gastric irritation, vomiting, and sometimes inhaled hydrocarbons can cause severe chemical pneumonia. Similar to kerosene is paraffin, which is again used as a burning agent, as an agent used in the lanterns, which can cause these poisonings because of the hydrocarbons. Rural India is again full of bright fruits and berries. Some of them are poisonous, and unknowingly sometimes children can consume them, fall unconscious, have seizures, and some of them cause serious cardiac problems. So to prevent poisonings in children, first, all the agricultural toxins have to be stored in a separate place under lock and key without free access to children. Kerosene has to be stored out of sight and not out of reach of children. And children need to be educated about the true berries and the wild berries, some of which can be poisonous.